People often confuse social anxiety with social awkwardness, since the symptoms are almost similar. However, with a discerning eye, the difference is as clear as day and night. To recognize the variation, it's essential to understand their nature. Social anxiety is a mental disorder characterized by fear of public scrutiny in social situations. Conversely, social awkwardness is a feeling of indifference or abnormality caused by a collection of experiences that trigger a pattern in one's life. The difference is further understood through symptom manifestation and treatment methods of both conditions. In this video, we will explore some categories in which social anxiety and social awkwardness differ. 1. Intuition. Intuition is the ability to understand things or assess situations instinctively, without the need for conscious reasoning. For socially awkward people, intuition can be short, and more often, their actions are defined by impulse. Whether it's trying to fit in at certain occasions, or to be acceptable to people. Socially awkward people typically overdo things, making them appear bizarre. On the contrary, socially anxious people are more intuitive, but lack the resolve to act in social settings. The fear of scrutiny from people makes them skeptical of their actions. This demoralizes them to interact, speak in social situations, or do things that make them the center of attention. 2. Enthusiasm. Socially awkward people usually tend to be enthusiastic. They typically express intense and eager enjoyment in doing things. The problem, however, is that the intensity goes beyond normal, making the feeling appear unnaturally forced. The opposite is true for socially anxious people, as they exhibit low drive in doing things or acting in situations. They are always full of premonition of imminent disapproval from everyone around them, even though no one is looking or concentrating on their actions. It therefore lowers their drive and subdues their energy, making them less enthusiastic. 3. Understanding social norms. Socially anxious people clearly understand social cues and norms but fear that they might go against them, especially in social situations. They are generally wary of mistakes, and this gets the better of their ability to express themselves. Oppositely, most socially awkward people miss important social cues and go against what's expected. Such cues as dress codes, the direction of their gazes, variation of mood, and weird facial expressions go unnoticed or ignored by socially awkward individuals. More often, they overdo them, such that they appear bizarre. 4. Anxiety levels. The degree of anxiety differs between the two types of conditions in people. Socially anxious people are usually apprehensive, and it can be extreme in most cases. Being a disorder, it's always difficult to contain it without others noticing. Social anxiety pushes people to shun social interactions or engage in social events because they are overly uneasy about forging relationships with others. Conversely, social awkwardness does not necessarily cause extreme anxiety. This results from elevated feelings of confidence or the misunderstanding of social norms, causing people to overcompensate. 5. Becoming the center of attention. A common sign of social awkwardness is engagement in non-consequential or rambling conversations. People tend to talk uncontrollably when nervous, and this makes them awkward. It happens typically in a bid to conceal panic or nervousness, making them the center of attention. Social anxiety, however, is different. People tend to avoid the limelight, and would shun any attempt to make them conspicuous. They usually are restrained and prefer keeping things to themselves. 6. Methods of their treatment. There is no known remedy for social awkwardness because it's considered a feeling, rather than a medical disorder. It can be self-diagnosable and can be dealt with personally. Social awkwardness does not translate to severe health damage when it goes beyond extreme levels. Therefore, it shouldn't be a cause of concern to affected individuals. Being aware of it can give one the ability to change. Nevertheless, social anxiety is medically diagnosable and needs to be treated once discovered. A corrective and successful remedy for this disorder is therapy, where a psychotherapist engages with patients in one-on-one conversations to determine treatment. Treatment methods include cognitive behavior therapy and psychodynamic therapy, among other acceptable treatments. Distinguishing between social anxiety and social awkwardness can be difficult. But, considering the symptoms displayed by both, it offers specific criteria to pick one from the other. For people affected by both, devising workable ways of dealing with symptoms or seeking medical attention is paramount to prevent severe cases. Do you struggle with social anxiety? Share your story or tips on overcoming social anxiety with us in the comments. If you enjoyed this video, then don't forget to hit the like button, give it a thumbs up and subscribe to our channel. Spread the love and send this video to at least 2 friends or your favorite group chat. Sharing is caring after all. Be sure to hit the bell icon to stay up to date with our latest videos. Remember to be polite to yourself first, so you can be polite to others. Take care of yourself. Until next time.